Welcome back to KETV Newswatch 7's Chronicle. For a while now, we've reported on the burden of the pandemic on hospitals across the state. And KETV Newswatch 7's Joey Safchik brought us this report a few weeks ago on the message from the Nebraska Hospital Association.
Another plea from Nebraska hospitals Monday.
We are still in one of the darkest times of the pandemic.
The Nebraska Hospital Association says the state's positivity rate more than doubled since the end of December.
COVID is still here. The Omicron virus is relentless. It's highly transmissible.
Some hospitals in less populated parts of the state are feeling it even more.
And because the big hospitals are full, it just has a rippling effect on our smaller hospitals.
Transferring patients continues to be a challenge.
We're calling between 40 and 60 hospitals to get a transfer for a single patient.
Those patients might have COVID, but they could also need a bed for a slew of other sicknesses.
And it really is hard to say no, that we are at our capacity as well.
And there's concerns hospitals will remain at capacity as long as Nebraska's population hovers around 60% fully vaccinated.
We know that this is still largely a disease of the unvaccinated.
Both small critical access hospitals and larger trauma facilities are having to postpone certain surgeries, even when crisis standards of care are not enacted.
Our patient loads and our staffing needs have grown exponentially, especially over the last 2 weeks.
Beyond the vaccine, methods to keep the community safe are limited, as is the supply of treatments and therapies.
We certainly don't have enough to go around with the numbers of positives that are coming out.
So doctors plead with you, do what you can to slow transmission and stay out of the hospital.
The gift that you could give to every healthcare worker across the state is the masking.
Joey Safchik reporting. The CEO of Bryan Health says the pandemic caught hospitals by surprise, like it did everybody. And Russ Gronewold told me it's forced them to adapt.
It has galvanized us around things that we probably weren't ready for. We weren't ready for a big public health crisis. We were interested in looking at public health or emergency crises, sort of as we've always thought of them, very temporary in nature. Very, very specific incident focused. And now we're in a big public health piece, and it wasn't something that we could do by ourselves. We all of a sudden were in sync with people from all across the state, public officials, trying to look at national things coming our direction. So it really caused us to have to think completely different about things like incident command and crisis management than we have before. So that's one side of it, and I think it will change how we look at some of this going forward. But on a real practical basis, the impact has been, really pretty tough on the healthcare systems. It has accelerated folks who wanted to get out of the system to say, "That's it, I've had enough." I think, on the other hand, it's caused many folks that, and I'm really, really excited, that so many of our folks have chosen to stay and support their teammates throughout all of this. Honestly, that's why a lot of folks have stayed. They said they're not going to leave now while their teammates still need them. But I'm concerned over the long term that what we're going to see is an exodus from healthcare. That's certainly what the surveys from across the nation show. And it worries us a little bit about workforce as we go down the road.
Go ahead.
When you talk about that exodus, who are you talking about? Just across the board, all jobs?
Certainly clinical jobs. I think it's not just nurses. That's what people tend to think about. It's respiratory therapists and nurses and lab folks and all of the folks who are up there every day in those isolation units, feeling isolated, feeling maybe a little bit in danger, although I think that over 2 years, we've gotten to the point where people feel very safe, but certainly early on, that was a concern. And then it's just the lack of routine, right? We're being tugged one way or another based on new information that comes out. Even a new variant changes everything that we might be doing for a patient because of what the new protocols might be.
We hear from people who say that we are overstating the seriousness of this when it comes to hospital capacity, that major hospitals are prepared and are equipped to handle this and maybe even have a little wiggle room built in. Is that accurate? Are we overstating the seriousness of this?
Yeah, well, I always talk about that in a couple of different ways. First of all, Every hospital is a little bit different. So our physical capacity, we're actually able and staffed to be able to use every portion of it. We're doing it through, lots of overtime, lots of extra shifts, traveling clinical personnel. And so we've been able to continue to use every inch of our building. Not everybody's in that situation. There are some folks that are still using their people the same way, but they're just out of people. And so they're not able to use all of their capacity. So I can't speak for every hospital, but we're certainly using every piece of it today. But what I tell people is, listen, we had 6 deaths in Lincoln yesterday. We had 11 people on ventilators today. It's certainly serious to those folks. It's certainly serious to the folks that are sitting in ventilators and in ICUs, and all of those folks that are really in a bad way. We're very thankful that Omicron has not been as virulent as some of the past variants, but certainly its infectiousness has overcome that. So we're at a high point. And again, if you think about the fact that we have 114 patients of COVID today in our hospital, and 45 are waiting to get in. For those 45, this is a big deal, and so it's significant for those folks.
Well, Russ, what metric do you use when you try to identify the course of this pandemic? If it's trending up or trending down, what metric do you look at?
Well, the first metric we look at every day is what's the case rates in the community. And I'm talking about raw rates now, not percentages, not percent positives. What are the raw number of cases that we're identifying? I know there are many that we're not identifying that because maybe there's a lack of testing and so forth. But if we know they're identified, likely they're serious enough that something's going on that we may be having to look at that. And so for us to see that the case rates are beginning to come down and have been coming down now for a couple of days, that's really important to us. And for all of the sort of worn out, haggard feelings we have about taking care of folks around here, that's the sense of optimism that we have right now, that in a couple of weeks, as hospital admissions typically lag, in a couple of weeks, we could really begin to see now our numbers come down accordingly. So that's probably the most important part. What's really difficult for us, again, serving as many communities as we do, is keeping track of that throughout the state. So we may get a surge in several other communities with folks that have to come our direction, even if the Lincoln-Lancaster rates are down. We're still the tertiary center many times for folks all across the state.
How do you keep your staff motivated to keep coming back to work?
Yeah, it's a great question. And again, I would say there's a lot of Midwesternness in our staff. They are heads down folks. They are rise to the cause folks. And so I wish I could tell you that we're out there cheering them on and giving them all of the right talks at just the right time. They're just really dedicated individuals. Their teams are dedicated to one another. It really is the team that's keeping each department's team that's keeping each other motivated and keeping that sort of glue together. Like, I'm coming in today because I can't let that person down. And again, I think that that's a particular Midwestern trait that we have fostered here, that our managers have fostered here, and we're the recipients of.
And finally, then you talked about Omicron. We had Delta. Now we've got the new strain, or one of the new strains is Stealth, the BA2. We ever going to be past this? Is this ever just going to go into the distance and just be endemic stage?
Yeah, I think it's absolutely going to be a point where it's endemic. I just don't know what that endemic looks like. I don't know if this gets to a once-a-year vaccination just like influenza, or whether or not we will continue to just have rolling surges for the foreseeable future. I tend to think this is not the last surge we'll see. I hope it's the last major surge we'll see. For the most part, with the experts that I hear, and probably the same ones that other folks have access to, suggest that we have some additional surges coming. But that's the message I think that we want to keep giving. Vaccines really work. They've been working for each variant so far, so get vaccinated. You don't have to fear this stuff. If you're vaccinated, boosted, when you're asked to wear masks, wear the masks. They really work when everybody's using them together. But when you don't do those things, then all of a sudden you have something to fear. And so my take is listen to the experts, keep doing it. And then that way we can just keep life going, even if it looks a little different through each one of those surges.
And that is the key, preserving life. At-home tests make it easier for people who've been exposed to COVID possibly, but they also make it harder for doctors to track community spread. That's straight ahead. First, what do you think about how the health systems have handled this pandemic, the strain on workers? Send us an email. It's news@ketv.com. Love hearing from you, and we'll be right back.